my name is Dr. Darren Moore, and I am an assistant professor here at Mercer University in the Department of Psychiatry and Behavioral Sciences. And I teach in the master's program in marriage and family therapy. Anyone heard of that program? Yes. Yes, okay. Excellent, excellent. And so today's topic is weight loss as simple as 1, 2, 3. Wow, right? It's just that simple. So I'm going to just give you a little bit of a background on myself, and I'm going to make sure I keep a track of time. So I am an assistant professor here at Mercer. I'm a licensed marriage and family therapist, so I work with individuals, couples, and families regarding a variety of mental health issues, from depression, anxiety, conflict within marriages, within relationships, parent-child conflict, et cetera, et cetera. I have my bachelor's degree from the University of Minnesota. That's where I'm originally from. So a lot of times people ask me, how did I get down to Georgia? And then how did I get down to Valdosta, Georgia, of all places, which is where I did my master's degree at Valdosta State University in marriage and family therapy. And then I got my PhD from Virginia Tech in Blacksburg, Virginia, and MFT as well. Previously, prior to coming here to Mercer and teaching in the MFT program, I taught at Valdosta State University. So it's interesting being a student there and then coming back and teaching there for a while and understanding the dynamics in terms of changes in relationships between faculty and myself. And then I taught also adjunct in the African American Studies undergraduate program there as well. So my programmatic focus of my research, my teaching, my clinical interest is really around obesity and weight loss, and specifically about how do we think about motivating people to address obesity as an issue, as well as how do we think about the impact that obesity has on couple and family relationships, which is kind of an interesting dynamic. And also, how do we think about addressing issues around children and the childhood obesity situation. I have a special interest in health disparities, so specifically looking at some of the health disparities issues. As I'm sure you all are aware, there are significant disparities as it relates to race and ethnicity regarding obesity. And then I'm also interested in general other areas, teaching, epistemology, self as a therapist, men's issues, and then applications of MFT in the media. Okay? So I'm going to talk a little bit about some of my research to kind of give you an idea of kind of this idea of obesity and weight loss and what is it all about and what my specific interests, where they lie. And so for my dissertation study, I did a study where I explored the experiences of men who had weight loss surgery. And so what I specifically looked at was, what was your general experience after having such an intervention such as bariatric surgery? And I wanted to know, how did it impact you as an individual? And then also, how did it impact you in terms of your couple and family relationships? Right? So one of the things that I found was that there were some significant changes once a person had undergone such a medical procedure, and specifically not just in terms of health outcomes, but also how it impacted your relationship. So you lose all this weight, and your spouse and your family, they're just going to love you for that, right? Is that typically what happens? Perhaps, right? If they're interested in you and invested in your weight loss, then that might be an option. However, in certain situations, there may be jealousy. Your spouse or partner may sabotage your weight loss process, right? And so these are reasons why it's important to have social support. And so after doing my dissertation study, I did a number of other studies where I looked at people's attitudes and perceptions regarding a variety of weight loss interventions. So whether they're surgical interventions, whether they're other types of interventions, behavioral changes, supervised diets, etc. And so my main interest is really, how do we think about, how do we conceptualize obesity, how do we talk about it, and then how do we address the issue? And how do we address the barriers that may present themselves for lots of people here in America and abroad, right? So some of the teaching aspects at Valdosta State, I taught a course specifically on obesity in families. It was a course that I developed. And we learned all types of interesting facts around how obesity can serve as a function for families, that sometimes families will actually establish bonds around their obesity status and how they are oriented towards food, right? And then I also, in terms of my clinical work, I've worked with individuals who are attempting to lose weight, whether they are trying to lose 5 pounds or 10 pounds, you want to get ready for a wedding or get ready for the summer, those types of things. But I've also worked with obese and morbidly obese individuals who are trying to lose a significant amount of weight. I've also worked with, on the other side of that, related though, I've worked with individuals with eating disorders. So anorexia, bulimia, and now binge eating disorder, which is what we're talking about in the newest DSM, or Diagnostic and Statistical Manual. In terms of the community, I do lots of things in the community, not just here, but in my hometown. I've helped out with fitness challenge programs. I've also done some things in kind of television and print, and I'll talk a little bit about that as it relates to obesity. So, of course, the summary you all read for today, while losing weight is never easy, it can be simple, right? Simple as 1, 2, 3. Join us for this hands-on event where we will outline simple steps to help you jumpstart your weight loss goal and give you the tools to assess your current diet and exercise lifestyle. All right, so whether your goal is 5 or 105 pounds, we have the tools to get you started. So when I read that, I was like, wow, I'm going to give you these wonderful, these tools, these interventions, right? You're going to come in here and you're going to be transformed, right? Simple as 1, 2, and 3. So I could talk about obesity and all of the issues that we know about, but you all are pretty much, I'm assuming, experts. We know the issues, right? It's just like when we think about smoking. We know that smoking is bad, but people still smoke. That's just the reality of it. Okay? And you get the picture that it is an issue, and we see it here, we see it everywhere. Obesity is an issue that we need to start thinking about how do we address. So, weight loss is simple as 1, 2, 3. Do you really want to lose weight? How many of you want to lose weight? Seriously? Really? How many of you really want to lose weight? How many of you are kind of on the fence? Kind of on the fence, like you think you might want to lose weight, you're not really quite sure. Depends on what I have to do to make it happen. How easy it is. Okay. So what's stopping you? For those of you who said that you wanted to lose weight. Willpower. What was that? Willpower? Okay, willpower. What else? Time. Tell me about time.
Okay, well, I work full time.
Okay.
And then I work full time again because I have 2 kids.
Ooh, all right.
And then I work full time again because I have a husband.
Uh-oh. I understand.
And then I'm in school full time.
Ooh.
And sometimes I gotta get a couple minutes of sleep and time.
Okay. I was going to challenge you, but I think you might have it. Time is an issue. I get it. Okay. Any other barriers? Willpower, time? Money? What do you mean by money?
If you're feeding 5 adults, it's very hard to eat organic or healthy. It's very costly.
Yeah, I hear you. Okay. Any other barriers? Well, consistency? Who said that? I'm sorry. Oh, consistency. So maybe not being able to stick to something, or okay. So I have a couple of clips I want us to look at. We're not going to watch all the clips, but I want to play a couple of clips for you. Let's see. And I think the volume should play. Do we know how to adjust the volume up here?
You're asking me.
Otherwise, I'll just interpret, what's going on. Okay. Well, I'll tell you about the clip until we figure out if we can get it to play. So, one of the things that I mentioned was that sometimes I do some things in the larger community. So, one of my interests is not only on conducting scholarship and publishing in journals as required in academia, but also thinking about how do we translate that to the community. Like, how do we take that information, that knowledge, and be able to connect to the community to help the people that are in the community? And so sometimes I may do that via television, or I may do that in print and other things. So the first clip that I was going to show you is from the Dee Armstrong Show, which is in Columbus, Georgia. It comes on WLTZ on Channel 38. And it is a typical talk show where they talk about a variety of issues and concerns, everyday life events. So in this clip, and this was actually this summer, she was talking about the Biggest Loser audition. So this summer, matter of fact, I believe it was July 18th, they had the Biggest Loser auditions in Atlanta, right? You guys are familiar with the Biggest Loser show? Okay. So she actually was talking with one of the casting directors who she was linked to, and basically they were inviting her to the show to come up and be a part of the audition process, to kind of explore what's going on, to interview some of the prospective applicants. And the casting director was providing some information about the types of participants they were looking for. Okay, so that was the first one. There's another clip that I was going to show where I was on the show and I was invited to go up to the Biggest Loser audition. Okay, so this summer I went up to the Biggest Loser audition, and I actually met with the casting director as well as met with some of the individuals that were considering joining the show. Okay, and so we were asking questions. And I was just really a guest of Dee Armstrong, but we were asking questions around, so what makes you want to, number one, be on such a show? And I don't know how much you know about The Biggest Loser. There are lots of critiques about it in terms of, does it exploit people? Does it actually re-emphasize and perpetuate some of these ideas and stigma around obese populations, but yet some people still want to go on the show, right? And so I was asking questions, and I mean, there was a line it was just all the way down the block, like 10 blocks, people lined up for this show, right? And so I was just like, what is that about? Now, granted, there is a prize. There is a $250,000 prize that one person can win. But that's only one person out of everyone that actually gets on the show. So I was really curious around, so tell me about what motivates you. And so some of the stories that I was hearing was, I'm at my wit's end, I need help. I've tried everything. I've tried diets. I've tried talking to a medical professional. I'm depressed. I've had all these issues in my family. I've had all these setbacks during my childhood. I mean, I was just hearing all these really sad stories about people's lives. And that for whatever reason, they felt like if they were to join this show, if they were to get casted in this show, then somehow this show would be the intervention that they need to be able to address all of those issues. Okay, and so yes, on the show, if you've watched it, people do lose weight, and there's lots of critiques around how they lose weight, if it's actually appropriate or effective, if it makes sense in terms of
We can do it that way.
That's fine. That's fine. I'm going to actually go to another clip though. So, but in essence, what people were saying were all these kind of sad stories. And I want to just play one clip of an individual that talks a little bit about doing a video audition.
Hey guys, my name is Philip Woods. I'm about 6'1", I weigh about 500.
Is that me? Sorry. Is that me?
Saturday in Atlanta, Georgia. We both got front of line passes. We were there about 1 o'clock. His name is Colby Wright. And he got
Can you guys hear? Okay, I'll interpret for you.
his second audition. And I didn't get no call.
Okay.
I'm doing this video now.
Is it? I don't know if it's gonna make a noise. So essentially, this individual is talking about how he tried to audition, and so sometimes what people do is they do a video audition as well. And he actually didn't get casted, but his friend got a call back. And so what happens is you go and you audition, and they will give you, some people they'll just turn you away, and then others they'll actually have you come up for a second interview. And so he's talking about how disappointing that was for his experience. And then he talks about some of the childhood trauma that he's experienced. Okay? And so I'm telling you this because the first question that I asked you all was, do you really want to lose weight? And the next question I would ask you is, what are you willing to do to lose weight? Because for whatever reason, there are people that are willing to do what I consider to be extremely drastic things in order to lose weight. I mean, you're willing to go on a show that's going to, from my own personal opinion, make you look bad in many ways, exploit you in many ways, but yet it's that bad of a situation where you actually go and stand in line for like hours and hours just to get a chance of interviewing with, prospective people on the show. So I'm going to go back to So, how many of you would go on a national television show to try to lose weight? Anybody in here? No. Okay. Would the money be a motivating factor for anyone in here? Yes? Kinda, sorta? Somebody said she's working 3 jobs, 3 full-time jobs. Would the money motivate anyone? Yeah. It totally motivated me. I'm just going to be honest with you, right? Would any of you be willing to take a break from your job? Because that's what's required for the people on the show. Okay. So I was going to ask you, what did you guys hear in the video clips, but you couldn't hear them. So essentially, a lot of what the people were saying were all this trauma that they've been experiencing, right? That there's something behind this obesity, that obesity can be viewed as a symptom of something else. And it could be just a symptom of I'm really, really busy and I don't have time. And it could be that I don't have the money to purchase these food items. But a lot of the people that were talking about how they were willing to join such a show, and there are lots of other shows, such as Extreme Weight Loss and lots of other ones, there was this notion that I have gone through a lot of trauma and I believe that this will give me that chance, that I've kind of been at my wit's end, okay? So they talked about desire. I have the desire to change my life, right? Maybe I don't have the skills or the techniques or the interventions to do that, but I have the desire. And I'm hoping that somebody is just going to help me. They're going to wave their magical wand and help me. Some of the people talked about, when I interviewed them in person, they said, by any means necessary, I have to do this. It's that important to me, right? They talked about dedication and motivation. There was some desperation there, like I don't know what else to do, so I'm going to be on this show. They talked about, this is my way of asking for help. You know, I'm overweight, I'm obese, I clearly don't know what to do to address it, so this is my way of asking for help. They talked about some of the obstacles that they've had in life, and then they also talked about issues with health, right? Does anyone in the room, and you can just raise your hands, have any issues with health that might be related to weight? Okay? Okay? All right. So, I'm going to ask you again, do you really want to lose weight? Ooh, she's laughing over there. She's maybe, kind of, sort of. Let me go get one of these kisses over here first, and then, and then I'll tell you after that. But how many can you have? But seriously, do you really want to lose weight? Because there are people that are willing to do whatever it takes, right? And I am not advocating for that, but I'm simply saying there are people that feel that compelled, where their life is dependent on it. Their children's lives are dependent on it, right? So I ask you, do you really want to lose weight? Or is it just something that, you know, we like to say because, you know, we think that that's what we're supposed to say? Okay, think about it. And then if you do want to lose weight, why do you want to lose weight? Is this coming from an internal system here? I want to lose weight because I want to help myself. I want to, you know, feel better about myself. I want to be healthy. Or is it that my husband told me, or my wife told me, or my sister, she's gotten smaller, so therefore I have to keep up with her, or, you know, this is what other people my age need to look like, and so this is my idea, right? So why do you want to lose weight? That's important. Can anyone tell me why that might be important?
That's your motivation. Stay healthy.
What was that?
Stay healthy.
Stay healthy? Okay.
Stay off medicine.
Stay off medicines? Okay. You were going to say in front?
It's gotta be your motivator.
Yeah, your motivating factor, right? So I'm going to segue really quickly. Although there are some correlations, or some people talk about obesity in terms of addictions and food addictions and dopamine levels in the brain and in certain foods like sugar and things like that. But one of the interesting things about addictions, for example, is that some people say, I want to get clean and sober for my children. Well, that sounds great and that's wonderful. But a lot of people cannot get clean and sober for their children. It has to be something on the inside that says, I want to change. It can't be, I want to change for my children. That's a great, you know, additional motivating factor, but you really have to have something inside of you that says, I want to change, right? Not only I want to change, but I'm going to change. I need to change. It's that big of a deal. It's that drastic of a measure, okay? So what motivates you all to lose weight? Can anyone tell me what motivates you? Is anyone motivated, or is that the problem? What was that? Too tight clothes. So you have some clothes on and you're like, this ain't gonna work. I gotta get my life together. Okay, what else?
Cholesterol level,
Yes, cholesterol level, absolutely.
discomfort or pain.
Discomfort or pain, okay. Anyone else? Blood pressure? Okay. And I'll tell you guys about me a little bit later, what motivated me. So as you know, there are lots of different types of treatments to address losing weight. Of course, there's personal attempts. How many of you all in this room have had a personal attempt to lose weight? Yes, me too. How many of you have done diet and exercise programs? Yes, okay. Fad diet programs. I know a little something about that. Anyone tried any type of over-the-counter medication or medication prescribed by a medical doctor? Yeah. Okay. Anyone did supervised diet programs, like low-calorie diet programs, things like that? Okay. And then other types of prescription medication, therapeutic interventions? Yes, no? Surgical intervention? You never know. Sometimes it happens. Okay.
VLCD,
What was that?
the VLCD is there.
Very low calorie diet.
Oh, got that.
Yep. Low calorie diet is usually 1,000 calories or lower. Very low calorie diet might be 500 to 800. Yeah, it's bizarre. Trust. It's bizarre. But it does work for some people. So, when you guys think about what motivates you, you need to be thinking about the weight loss challenge here at Mercer. That's going to be kicking off in September, right? That we talked about in the beginning. So, you have to first do a personal inventory, assessment of your health and mental health. Okay? So, as you know, for health issues, we're talking about perhaps, anyone know anything about OSA, obstructive sleep apnea? I know about it. I have a CPAP machine at home that I used to use. Okay? Hypertension, anybody know anything about hypertension? Okay. Diabetes, heart disease, cancers, things like that. Okay? Mental health, for some people it can be related to an eating disorder. For some people, we have issues around depression and emotional kind of eating, body image issues or self-concept, how you think about your body. And then we know about social stigma, which we don't talk about that much, but it's very real. I'll tell you, I had a colleague of mine at another university, and she told me that they were interviewing for a faculty position, right? And they said this male that came in, he was super qualified for the position. I mean, he had everything together. But he was significantly overweight, okay? And this colleague was just telling me, you know, off the record, that this colleague and some of the other faculty members were talking about his weight. Do you believe that? It seriously happens, right? And so they actually did not recommend him for the position because they felt like his weight is indicative of this idea that this person may be lazy, right? That they may not be a hard worker. They lack discipline, right? These are some of the stigma and some of the stereotypes around obese individuals. Some people are victims of public ridicule, weight biasness, or weight-based discrimination or stigmatization. It's real, okay? So these are some issues that some people may actually deal with, and although we don't talk about it, they may actually perpetuate part of the problem. So then you get this overweight or obese male who now gets denied for a job, although he may not know that it's due to his weight. But like I said, his curriculum vitae was just amazing. And the person that they ended up hiring, from what I understand, was not up to par. Okay? As we know, there's always politics in academia or whatever. But I'm just simply saying, I mean, we're at Mercer, come on now. But, you know, imagine how a person might feel if they actually were made aware of that. Right? So that can contribute to the problem. So in terms of intimate relationships, these are some problems that may occur as it relates to weight status and specifically being overweight. Issues related to infertility, did you know that? Yeah, for real. Reports of less sexual excitement, avoidance of sexual encounters, lower sexual activity, and less satisfaction within the sexual life. What do you think about that? Is that for real? Maybe. Yeah, somebody said, yes, I know. And then, of course, some issues with erectile dysfunction, right? These are like real things, real issues that people may have. Of course, you all know this, but we're going to go there today. Obesity, of course, considered a label for ranges above what is considered a healthy weight for a particular height. So we talk a lot about BMI, and yes, I can critique BMI, and I can talk all about the bad aspects of BMI, but nevertheless, BMI is still a very good way a good method, or at least an idea, to think about in terms of a guideline. Okay, it's not the best way to kind of think about weight status, and yes, there's lots of critiques about that, but BMI is still very much utilized. Okay, so we're going to talk a little bit about BMI real quickly, because nobody wants to talk about BMI. Body mass index, of course, is one of the most widely used methods, of course. And yeah, I can teach you how to calculate it by hand, but everybody has an app on their phone, or they can Google it on, or check out Yahoo how to assess their own body mass index. So a person is considered overweight if they have a BMI of 24 to 29. A person is considered obese if they have a BMI of 30 or higher. And a person is considered to be morbidly obese if they have a BMI of 40 or higher. Okay? So just to give you some ideas, because I do a lot of research around people who have weight loss surgery, usually a person can qualify for weight loss surgery if they have a BMI of 35 or higher with a comorbidity like sleep apnea, diabetes, hypertension, etc. And or 40 or higher. However, with the obesity epidemic being on a rise, they are actually talking about lowering the BMI requirements for surgical intervention all the way down to 30. Okay, specifically for the lap band as opposed to the Roux-en-Y gastric bypass. And I say that to say that we need to be thinking about what our BMI is. It is important. Okay, the BMI categories are independent and the same for both sexes. Of course, a given BMI may not correspond to the same degree of fatness in all cases, of course, male and female. And it may not be an adequate way of measuring risk of disease, although there is some research that links BMI to a disease. Yes, there is this idea of healthy at every weight, and I support that idea as well. It's about being healthy, right? Although I do believe that BMI is important. Yes, one of the critiques around BMI is around muscle, and muscle weighs more, and therefore it may not be a great way to think about our health status, but it's still a pretty good guideline. Okay? How many of you know your BMI? Ooh, some of you. For those of you who do not know your BMI, why don't you know your BMI? Is it because you don't want to know? Are you afraid to actually explore that? Are you afraid you might have a nervous breakdown? Okay. Well, I won't make you do it in here, but I want you to think about getting ready to check your BMI. At some point, maybe later today, maybe later this week, sometime this month. Check your BMI just to see where you are. Okay? It may devastate some of you, it may not. Okay? But you should know your BMI. So, going back to motivation, for some people, it could be physical appearance. I want to feel better. I want to be able to fit into these clothes that I bought. For some people, it may be internal, and that's the best way, right? For others, it could be external, but that may not actually sustain you over time, right? So one of the things I tell people in some of the talks that I do is that anyone can really lose weight, but the difficult thing is, can you keep it off? Can you maintain that? And so having that kind of internal mechanism, that's what's going to sustain you, as opposed to, I just want to lose weight to fit in this dress. Well, now you've gotten married, and now you've gained the weight back. Now you can't fit into the dress anymore, because you weren't thinking about it from an internal kind of perspective. Okay? So, of course, internal is going to be the most important. So, some of you may have heard of the trans-theoretical model. How many of you have heard of it? How many of you? I know we talked a little bit about it over the phone. So the trans-theoretical model, of course, is this idea of, or a way to assess where you are in terms of your readiness to address change. So one of the questions that I asked you all in the beginning was, how many of you want to lose weight, right? And then some of you are like, yeah, I know I want to lose weight. How many of you ready to lose weight? Maybe a different story. And when I asked some of you, you kind of said, well, maybe I want 2 or 3 more kisses first, and maybe I want to get through Thanksgiving first, and then maybe Christmas. And then there's, of course, if you have anything on the New Year's, and then Valentine's Day, and so you just kind of, well, then I want to go on spring break, and well, you got to get to a barbecue in the summer, and then, there's the state fair, and so you just kind of like, I don't know when I'm going to get my life together. So the trans-theoretical model is really going to be focused on kind of thinking about where are you in your readiness for change. Okay? So pre-contemplation, in this stage, people do not intend to take action in the foreseeable future. So if you don't really foresee yourself kind of taking any action, you're in the pre-contemplation stage. Some of you in this room are in that stage. Some of you say, oh, I might want to lose weight. I think so. I kind of don't. Y'all are probably in the pre-contemplation stage. Okay? This is not going to get the job done. Okay? This is not going to get the job done. So at some point, we're going to have to get you from this stage to another stage. Okay? Contemplation. Some of you are there. Contemplation, in this stage, people are intending to start the healthy behavior in the foreseeable future. Okay? So people recognize that their behavior may be problematic, and a more thoughtful and practical consideration of the pros and cons of changing the behavior takes place. So you're kind of thinking about it. Yeah, I think I can. Right? So contemplation is where some of you are probably. Preparation. In this stage, people are ready to take action within the next 30 days. How many of you are ready to take action in the next 30 days? Ooh, so the hands are just diminishing every question. First it's like, oh yeah, I want to lose weight. Then it's like, okay, I don't know about the next 30 days. Okay, so if you are ready to take change, you're in the preparation stage. Okay? So action. In this stage, people have recently changed their behavior and intend to keep moving forward. So if you've already kind of started on that process, some of you may be here, a couple of you may be here, or several of you may be here. It depends. Okay? Maintenance. In this stage, people have sustained their behavior change for a while, defined as more than 6 months, and intend to maintain their behavior change going forward. People in this stage work to prevent relapse to earlier stages. Okay? That's probably where I am. Maintenance, trying to maintain, right? And then termination. In this stage, people have to have no desire to return to their unhealthy behaviors and are sure they will not relapse. So I may be between the last two. Termination, I don't know. Sometimes I could, might want a cupcake, right? Perhaps I don't engage in that, but I might still desire it. Okay? So I want you to think about what stage you are in. How many pre-contemplation do we have in here? Okay? What about contemplation? You're thinking about it. Okay? Preparation. Y'all are there. Okay, here we go. Y'all are going to do the challenge in September. Action. Yes. You guys are great. Okay. Any people in maintenance? Trying? Okay. And then this relapse, of course, is a function of every system that a person can kind of go back to a previous level. So, how willing are you to change? What is stopping you? And what are you going to do about it? That's what I want to know from you. Who can tell me this? Who can give me an answer for this? How willing are you to change? Very. Okay. Okay. What's stopping you? Your salad? Wait, what did you say? Oh, yourself. I was like, your salad? Really? Yourself. Okay. Okay. Well, you know what? I really appreciate that answer because I think that what you're doing is you're taking your own personal sense of responsibility and not saying it's someone else. So I appreciate that. What are you going to do about it, though? You said what?
I said whip my tail.
Whip your tail? Okay. So I'm going to give you the 1, 2, 3. Weight loss is simple as 1, 2, 3. It really is as simple as 1, 2, 3. Okay. So the first one is make the decision. So some of you have made the decision and some of you are still kind of like straddling the fence. How many of you are ready to make the decision? Honesty, I love it. Some of you are ready and some of you may not be. Okay, so number one to this 1, 2, 3 is going to be make the decision. Don't wait the wait. And that's what I was alluding to before. We always have some type of excuse. I'll do it later. I'll do it later. I have enough time. Let me go ahead. There's a birthday party this weekend and I know that so-and-so is going to make that favorite dish that I love, so we'll start it next week. How many of you have decided to delay a diet start? Yes, okay, right? So you want to make the decision. Don't wait the wait. Behavior change starts in the mind. Just like relapse starts in the mind. It's all about how you think about this whole process. It's not even about how much money you have or about the multiple jobs that you have. It really starts in the mindset. Do you really want it? Because there's always a way to make it work. Okay? So that's number one. Very simple, right? Make a decision. How many of you made the decision to get a job? How many of you made a decision to go to school? Right? How many of you made a decision to go to college? Right? You've made a decision. You're capable of making a decision, correct? Although sometimes it's difficult. I don't know if I want to marry that person. I don't know if I want to relocate out of Georgia. I don't really know if I'm ready for this or that or the other. So sometimes making a decision can be difficult, but you're all capable of making a decision. So you need to make the decision as it relates to trying to become healthy. Okay? That's step one. Number two, very simple, act. So many people have this idea like, oh yeah, I'm gonna do this, I wanna do this, I have a vision for myself, right? But you need to put that into works, right? It's not rocket science, it's very basic. You need to act. Stop getting ready to get ready. Make sense? So many of us get ready to get ready. Like, okay, yeah, I hear you. I hear you're talking to me. I understand. I get it. I understand BMI, right? Stop getting ready to get ready. Okay? Just act. Put your decision into action. Small steps are okay. So it's not about, all of a sudden you've gone from, being on the couch all day and now you're like running 10 miles. Like, really? Just stop it. Little baby steps will be helpful for you. And actually, if you try to take, steps that are too large, it will probably deter you. And you're like, okay, you know what? I just tried to run 3 miles and I'm out of breath, right? And so that may deter you and say, forget this. I'm just about to go sit down and watch my favorite television show on Thursdays or Wednesdays and get me those chips. My vice, I love Doritos, right? Reese's peanut butter cups and things like that. But you have to take small steps. So it doesn't mean completely change and alter the system and stop everything that you've been eating, but to kind of make some small changes. Because small steps turn into big steps, right? So you have to start somewhere. So that's number two. So number one was what? Make the decision. Very simple. Number two is to act. Okay? Number three is stay the course. And that goes back to what one person was talking about in terms of consistency, right? So to be successful, it takes hard work. It's not going to be easy. How many of you have done something that took a lot of work, right? Relationships, marriages take a lot of work, right? And sometimes people don't want to put in the work, and that's why they come see me, and some of them end up getting divorced, right? Because it takes work. Everything that you do takes work. If you want to do something, you want to make a change, you want to be successful, whatever, it's going to take some work, period, okay? Unless you just got a whole lot of money and you can buy things and pay someone to do it for you, right? Do not let a slip turn into a fall. So a lot of times people, they slip up. Okay. I had an extra piece of cake. You know what? I might as well just say, forget this diet, forget this weight loss process. I'm just gonna go get me another piece of cake. Right? I'm guilty of this. Seriously. So sometimes we can sabotage ourselves, right? So if you do slip, don't let that turn into a fall, right? Stay the course. Get back on track and utilize your resources and social support. So I talked about some of my research around weight loss surgery, and specifically working with weight loss surgery patients, and how social support is so important. So here, within the weight loss challenge that we'll be starting, it's important to utilize your social network, right? Your peers, your colleagues, your friends, your family, social media if that's your thing, right? Utilize your social support, okay? So, 1 is going to be make the decision. 2 is going to act, and that's me on rollerblades. I rollerblade like every day. I love it. That's what I do. And then I ride a little bit, but you know, I'm not really a big fan on riding bikes. But I do a little bit. And 3 is stay the course, okay? So, I'm going to talk about how research is, what one of my colleagues says, research is me-search, right? And I'm going to see, where am I at on time? Oh, okay, I'm gonna get y'all done. So a little bit about me. Yeah, I was overweight, I was obese, what was me? I was 375 pounds, for real. It's real deal. I had sleep apnea, as I mentioned earlier. I had some other health issues as well as issues in my family, and I had to make the decision, and I had to act, and I had to stay the course. And it's not easy. It's really not easy. For me, it had to be internal. I had the desire. I mean, I'm a researcher at heart, so I research every diet out there, every fad. I probably have done every diet that you have done, and then some. And so for me, I had to really find out what works for me. And that's one of the, I think, difficult things for people, is that there's not one intervention that works for everybody. If that was the case, we would all be, we'd all look a certain way. Based on who you are, based on your circumstances, your situation, financial background, where you live, what you have access to in terms of resources, that's going to impact how you think about what interventions work for you. Okay? But I'll tell you one thing. Whatever you do, you need to make it fun. That's like the key, is to make it fun. So do what makes you feel happy, right? So I rollerblade, I dance, seriously. I do things that make me feel happy, right? But through this process of doing the weight loss challenge here, and all the resources that are available to you here at Mercer and within your social network, you will find what works for you. It's specifically related to the diet. Some of you can go vegan, some of you can't. Some of you can do a couch to 5K, and some of you cannot. Like everyone is going to have a different system that works for them. Some people like to walk at night. Some people like to walk in the morning. It's gonna be based on who you are. And so part of this process is exploring that, right? So this is me over here. They're both me, but this is big me. This is old me, I guess, whatever. I was still cute, of course. But I was 375 pounds. I was a 56 in waist. If y'all know what that looks like, I don't know. I was in a 64 jacket. So if you know, I mean, it's mostly women in here. Well, there's some men in here, but if you know those jackets, I mean, seriously. Weight, size for pants, it's just very different, very drastic. And for me, I had to find a program that worked for me. I had to find out what worked for me, because what worked for someone else doesn't work for me. But it's part of my own weight loss process that really makes me passionate about the topic of weight loss and really wanting to help people to find out what works for them. And it's hard out here. I'm gonna tell you, it's not easy because sometimes I do want to have other types of food, but I don't allow myself to. And that works for me.
You never eat any of the
I very rarely, like maybe once a year, I'll have a piece of cake. I don't do desserts because that was something that, I can't do desserts because there's a part of me that feels like if I have a piece of cake, I'm going to go back for a second and a third. So I just don't even allow myself to entertain that idea. That works for some people. Some people can have a piece of cake and only have a piece. That just wasn't me. If I have a piece, I need to have 2 or 3. And so you have to kind of know yourself. And so I know myself very well. If somebody had brought those Reese's peanut butter cups, I would have said, get them off the table. Because they were something that I love Reese's, I still do. I love Reese's peanut butter cups. And I love them with ice cream or whatever. So, so I gave you the 1, 2, 3, and maybe you'll get the 4, 5, and 6 in the September weight loss challenge. Okay? So I'm really hoping that you guys all consider being a part of that process. But it does, once again, start in September 14th through the 9th, as I understand it. And I really would highly encourage you all to consider being a part of this process because you said that you want to change. Some of you said you want to change. Some of you said you want to lose weight. Right? Right? Okay.